One.
Good afternoon, everybody, and thank you so much for joining us for our special event commemorating the shameful turning away of the St. Louis, a ship that was filled with Jews trying to escape Nazi Germany. My name is Cathryn Miller-Wilson, Executive Director of HIAS Pennsylvania, a nonprofit whose mission is to provide legal and social services to immigrants and refugees. When Jewish refugees were turned away from the U.S. on June 6, 1939, many perished in the Holocaust. Every year around this time, HIAS Pennsylvania hosts an event to teach about what occurred and reflect on the lessons learned about the MS St. Louis and its, quote, voyage of the damned, unquote. So thank you to everyone who has submitted questions already. We're excited for your conversation today. If you haven't already done so, please submit any questions you have during the next half hour in the comments section below. If we don't get to them during this live conversation, we'll answer them in the comments. Today, we're really thrilled to be speaking with Professor Jaya Ramji-Nogales, Professor Jaya Ramji-Nogales, about what it would mean if the United States continues to turn away refugees after the coronavirus pandemic. This question is more than theoretical. The latest policy from the federal government proposes making 15 different changes to the asylum process, all of which would significantly hinder an asylum seeker from obtaining asylum, and as a result in that person's deportation. Refugees before the pandemic were already substantially prevented from coming between the Muslim ban, which prevents refugees from certain countries, and the overall refugee ceiling, which was set lower than it has ever been in our country's history. Since the pandemic, there's been a worldwide shutdown of refugee resettlement, although HIAS Pennsylvania has continued to resettle a few refugees from Manus Island. The fact that these refugees have been resettled safely here is an indication that resettlement can continue safely, but we continue to hear false concerns about refugees, which is preventing the entry of those seeking refuge from persecution and death, including children. Professor Jaya Ramji-Nogales specializes in immigration law and international law, procedure, and process. Her research areas include asylum and refugee law under the Trump administration and global migration law. And she created the Temple Law Asylum Project, which provides tailored country conditions research to support asylum seekers and their attorneys. So I'm going to start with a question from me, Professor Ramji-Nogales. How has COVID-19 affected the refugee and asylum programs in the United States?
So let me start by saying thank you so much for having me. It's really a pleasure to be here, even though the topic is a little grim. It's really important to get the information out. And I should say that I created the Temple Law Asylum Project with the help of my fantastic students. And so they should get all the credit for doing all the legwork. It's been really a wonderful project to work on with them, a little bit of hope during these really challenging times. So the way I think of how the pandemic has affected the refugee and asylum programs in the U.S. is that the Trump administration has just really used them as a culmination of a broader agenda that they've pursued since they came into office, since the first week of the administration in January 2017, which is really eliminating refugees and asylum seekers from the United States. So we can all think back to January 2017, and the Muslim ban was the first big thing that happened. But actually that same week, for folks who work in the area, as we know, there were also executive orders relating to interior enforcement and border control, which the administration has played out over the past few years. And I really think of it as kind of 2018, like late 2018, when the administration turned their focus from refugees to asylum seekers. So first of all, they had several iterations of the Muslim ban, one of which is still in place and has been upheld by the Supreme Court. Then we saw in January 2019 the Migrant Protection Protocols, also known as the Rain in Mexico policy, where, and that was previewed in this first executive order, where asylum seekers are sent back to Mexico to await their hearing, which obviously we'll talk a little bit more maybe later about the dangers, but it also makes it very hard to access lawyers and resources they need to apply for asylum. In October 2019, we saw these programs known as PACER and HARP that really sped up processing of asylum seekers. We've seen the asylum cooperative agreements with Guatemala and Honduras, and so they're sending asylum seekers back to those countries that don't even have asylum systems, and countries actually that have a substantial presence of gangs that those very asylum seekers were seeking to flee from in other countries. So I really see this as they think this is an opportunity to overturn the 1980 Refugee Act, to undermine our international obligations under the Refugee Convention. The Refugee Act, as you know, Kathy, was about refugee resettlement, which HIAS does lots of, and then the asylum process, which HIAS also works on too, and the idea that regardless of your immigration status, which comes directly from the convention, if you get here and claim protection, we are a nation that's going to protect you. And so what I really think the Trump administration has done is now taken COVID and use it as an excuse to shut down our borders. So we had this regulation in March issued by the HHS. And there's the regulation says the CDC director can prohibit entry when there's serious danger of a communicable disease coming into the U.S. And so they just began expelling people at the Mexican borders, even asylum seekers. You can't even come in and ask for asylum. We take their fingerprints, we send them back. And so now I've seen the different numbers ranging from 15 to 20,000 people are stuck in limbo, right? They're being deported, they're turning away unaccompanied children. All of this in violation of federal law. And then, of course, this order, as you know, was extended indefinitely in May of 2019 until the CDC director determines there's no longer a danger to public health. And kind of most painfully, perhaps, Trump is relying on this 1944 expulsion policy and ignoring any subsequent legal developments to prohibit his administration from doing what they're doing.
Well, and if I could just uplift 2 points from that, right? And you can correct me if I'm wrong. First of all, the 1980 Refugee Act, which I agree this administration is in the process of trying to dismantle, was in fact born out of the Geneva Convention, born out of the number of Jews and others fleeing Nazi persecution who were turned away and sent to their deaths. Isn't that true?
Absolutely, right? Just like the St. Louis, right? That is the example that we all say, remember the St. Louis, we don't want to be responsible yet again as a country for sending people back to their certain death. And yet that is exactly what this administration is doing right now. And it's tragic to see that we're not learning from history's mistakes.
Absolutely. And then just one more important point, infection. So our borders have been closed since, I believe, March 18th. Does that sound correct?
That sounds around right, yeah.
And yet infections are steadily on the rise within the United States, as further proof that it has nothing to do with asylum seekers and, keeping people who are seeking refuge out does not do anything to help our public health. That it's really what we need is leadership.
Right, and in fact, what we're doing, as I'm sure you know, is we're actually sending the coronavirus to, for example, Guatemala. As we deport asylum seekers, we've seen dozens detained and then deported and then tested positive. And at some point, Guatemala said, you got to stop sending us these flights, because if you think about the impact it's had on the United States, on this incredibly wealthy country, they just don't have the medical and other infrastructure to deal with this. But what we're doing is we're sending these problems outside of our borders. We're sharing the disease with our southern neighbors and not supporting at any of their people.
It's terrible. And I've even read stories, perhaps you know more about this, about because of that fact that recent returnees have been beaten up and hurt by their fellow Guatemalans because of the fear of getting infected. Do you know anything?
Yes, absolutely. I've heard those stories, and I know that most returnees, folks who've spent some time here in the U.S., are really obvious. They're very visible when they return because especially if they've been here for a while, right? They maybe speak differently, they maybe dress differently, and they're very kind of visible to people. And yes, they have been treated reprehensibly on arrival as well.
Which again is further proof that they are deserving and in need of asylum. Ugh,
Right.
it's a terrible, vicious cycle. So I wanted to ask you, to some extent you've talked about this in terms of the people seeking refuge. Do you have any thoughts about the short-term implications for our country in keeping our borders closed?
Yeah, so I think that's right. So we talked a little bit about the implications in Guatemala. For the folks in Mexico, I just wanted to say one additional thing, which is you're absolutely right that it's not clear that it's keeping us safe, and there's really, really deep concern about what's going to happen when it starts to spread at the border, because these are people who are living in really, really inadequate shelters with inadequate medical care. They have very limited opportunities to wash their hands, to do all the things that we're doing, to self-quarantine, to keep ourselves safe. So I think just across the border, it's really terrifying what could happen to these families who are living there with small children. I think the other thing that we should think about is that many of our essential workers are immigrants, some of them asylees, some of them refugees. We have over 200,000 DACA recipients and over 130,000 TPS holders who are essential workers. And so these are the people who are caring for all of us right now, who are keeping us safe, who are enabling those of us with the privilege to stay in our homes and keep ourselves and our families safe. So I think we really need to think about the role that these folks are playing in our country, because I think the implications in the short term and the long term for us could be really terrible.
Yeah, I think that's right. And many of the essential workers are also healthcare providers, aren't they?
Right, absolutely. So healthcare providers and providing care for the elderly, care for children, all of those kinds of workers, I think.
And I think in terms of long-term effects, I mean, it's sort of related to this essential worker question, but even broader, right? I mean, what are some of the longer-term effects of keeping the border closed as we are an economy that is currently now destroyed and that will have to be rebuilt?
So there are huge economic implications, and this, of course, we're really focused on refugees and asylees because that's what I focus on, and that's, of course, a lot of the work that HIAS does. But right there are kind of far broader scale bans envisioned, keeping people out, and we historically, our strength as a nation has come from the fact that we're a nation of immigrants and people who want to get a great education, who want to serve, come here and serve the country and make the country better. But I want to raise really a deeper and more important point that I think our humanity is under threat. I think our very identity as Americans, who we are, we're a country that welcomes people, that protects people, that brings in people. We're a country built by immigrants. I think that vision is really under threat by this administration that really wants to take us back to the 1950s or some other time when immigrants weren't welcome and when the country looked really different than it does now. And I think that threatens the very essence of who we are as Americans, and it certainly is going to threaten our economic interests and our strategic political interests and all kinds of other interests. So this administration, I think, is using these dog whistling tactics to appeal to a narrow political base in a way that I think is really, really going to backfire in years.
Thank you. I couldn't agree more, obviously. I also, want to point out, I know my question was about this country, which, as Americans we're concerned with, but there's also worldwide implications, not just for our standing, which you alluded to, but also, I mean, the last figure that I saw, correct me if I'm wrong, is that there are 79 million displaced people in the world, up from 76, up from 71, that it has gotten that high. Is that your understanding as well?
So it's the largest number that the world has ever seen. And, you know, the UN High Commissioner for Refugees has been sounding the alarm bells for a long time. And we actually saw Obama in his last year in office kick up the number of refugee placements to 110,000. And now where are we? 11 or something ridiculous. I mean, so what that means is that people who are in, you think about Syrians, you think about other people who are in these really, really vulnerable situations, just aren't going to be protected. And I think that bodes really poorly for our future as a the globe's future, right? As a global community, it doesn't serve anyone well to have people who are suffering, who can't access basic needs, healthcare, safe housing, and show their potential, grow to their potential as human beings. So both in terms of what we're contributing and in terms of our lack of leadership on a global stage.
Absolutely. And I think we've, you know, one of the things this pandemic has done is really made stark the fact that we're interdependent on one another, and that, you know, worldwide shortages impact us directly. And so thank you. So my next question is, getting back to the proposed rules that you had mentioned, the proposed asylum ban, the 15 changes that I referenced in my introduction. What does it mean, if you know, if it were to go into effect for asylum seekers who are already in the country? So we've just been talking about keeping people out of the country, but we know that there are people that are here already, that haven't been deported, that have filed for asylum. What does this proposal mean for them?
So the proposed reg is really terrible. I'll talk a little bit first about what's happened with the pandemic. So with the pandemic, what we've seen is that processing for asylum seekers has come nearly to a standstill. So the administration suspended asylum processing from April 24th until June 4th, and then it rescheduled all the cases that weren't heard in that time. So they were pushed way back. What does that mean for these people? It means that those who didn't already have employment authorization, that's going to be pushed way back. It means for folks whose family is still overseas, genuine refugees who are here fearing persecution, it's going to take that much longer to get their family here. And we're seeing dates that are just so far out now that it's hard to imagine. They're being pushed so far out. I'm sure you know this. So that's in the asylum office. In March of 2020, there were over 1 million cases pending in immigration court. So that was the backlog in immigration court in March of 2020. Even more terrifying, the immigration courts refused to postpone non-detained hearings for several weeks. And then they moved to telephonic hearings for detained and unaccompanied minor cases. So between putting people at risk in person and just suspending everything. People can't get the biometrics they need to process their work authorization. Postponing naturalization ceremonies, which means fewer naturalized immigrants who can vote in the elections in November. So we've seen a real standstill in processing. We've seen immigration detention, right? These huge risks. Under the Trump administration's changes, nearly all asylum seekers are put into prison, to immigration detention. In late February, there were nearly 40,000 people in immigration detention, and COVID just spread rapidly to these incredibly vulnerable people, many of whom had done nothing wrong, who committed no crime. And so there are all these cases known as habeas corpus cases filed in federal court. I mean, there are too many to count at this point, but requiring ICE to release people. And the federal judges, largely who saw these cases, were just outraged at what was happening. And then in May, we saw, horrifyingly, what's known as family separation 2.0. So the Trump administration telling parents, we can either let your children out of detention on their own and you can separate from them, or you can stay together in detention indefinitely. Of course, all the parents said, we'll stay together in detention indefinitely, but what kind of a choice is that to give parents, that your kids can be locked up or they can be separated from you? So that's what was happening just as a result of the pandemic. And now it's just, I mean, I can't possibly go through every aspect of these new regulations that you're talking about, Kathy, because it would take a full half an hour, but it's just completely gutting the system. In particular, asylum for women fleeing domestic violence, which has long been, has been an accepted grounds for asylum for at least since it's the end of the Obama administration. That's going to be completely cut out, right? They're just changing all kinds of, they're changing the system in all kinds of ways, small ways and large, that will make it really nearly impossible for people to gain asylum. And we had a discussion, a bunch of immigration law professors about this, and we looked through the list and we thought, who is going to now be able to fit within those categories? And it's so vanishingly small. So really, it's a way to destroy the asylum system. And just one last thought, which is that I taught refugee law and policy this spring, which was an incredible moving target. And my students were wonderful. And one of them just said, what are they doing? Why don't they just go out and say, we're getting rid of the asylum system? Because that's what they're doing without announcing it. Right? That's really what they're doing. And why go to all this trouble to pretend that we still have a system when we actually don't? Actually, no one is going to be able to be protected, certainly not the most vulnerable under this new regulation.
Right. And I think I really appreciate your stressing that latter point, because for our listeners, it can be very hard to understand what's going on. And I think that is part of the strategy that this administration is using, because they know that if they were to simply announce, that's it, our borders are closed and we're not accepting anyone, there would be all kinds of public protests and issues and congressional attempts to step in and lawsuits, etc. If instead they change regulation by regulation by regulation, it just frustrates things and also keeps it invisible to the public.
And that actually takes me back to the St. Louis. There's that wonderful PBS special about the St. Louis, and they talk about how difficult it was to get a visa, that you had to fill out forms in sextuplicate, and the forms were, 9, 10, 15 pages long, just so that no one could get here. And that seems to be exactly what's happening here, is just creating as many possible bureaucratic hurdles to humanitarian protection.
Right. And it definitely, I'm glad that you brought up that example, because it gave Roosevelt cover, like, oh, we have a process. All they need to do is follow the process. But the process was so prohibitive that Jews, in fact, were not allowed in. And so that's what happened, and that's what we're seeing now. I think another thing that I want our listeners to understand, particular to asylum seekers that are here, while they are here and while they are seeking status, they do not have status, right? You can't get status until you have status. So they're in this kind of shadowland where it's difficult for them to get employment. It's difficult for them to kind of navigate without the constant anxiety of something happening. And at the same time, it's not an option for them to simply go home, because that's the point, is that they were fleeing persecution, sometimes torture, from their homeland. And so we're creating, by these policies, one of the many evils that is happening is that it's a government that's creating an entire underclass of people who are restricted from living their lives safely and self-sufficiently, and who have nowhere to go. So that doesn't make any sense. It's like the opposite of what a government should be doing for its people. So I just wanted to make that clear. All right. So then I want to talk about a really bad statistic that I think a lot of our listeners may not know about. 900 children have been deported in the middle of the night since the start of the pandemic. And I wanted to ask you, to your knowledge, has this happened in our country's past?
So I don't know if we've ever seen anything quite on this scale, Kathy. I mean, this is really horrifying, pushing these kids out in the middle of the night. I mean, and we know there have been over 1,000 kids pushed back at the border in violation of federal law as well, who've had no chance to seek asylum. So this just seems really like a coordinated effort to deport vulnerable children, particularly those in the MPP program that I spoke about before. But what I will say is, the 2008 Trafficking Victims Reauthorization Protection Act, known as TVRPA, that act Congress specifically put in place because it was worried that the government was deporting kids without properly examining their claims to asylum, without properly understanding whether it was safe to return them home. And these are kids who have a really hard time advocating for themselves, getting their stories out. So what the TVRPA did, what Congress did with that act, was to create a process for kids to make it easier for them, to give them the support they need, for kids who are here alone, who don't have an adult to advocate for them. And the Trump administration, again, just seems to be eviscerating that act by sending these kids back without properly determining whether they need protection, whether they should be protected by this country that has the ability to do so. So that's just really concerning. To me, the administration is breaking the law in so many ways, but heartbreaking to see when it comes to these unaccompanied kids.
Oh, it's terrible. So I mean, I don't want to end in a complete depression, which it's hard not to.
Right.
But what are some actions that you think we can take to stop this from continuing to happen? What are some things that we can do?
Yeah, so it's a great question. So I definitely want to end on the note of there's lots we can do. I hope this episode has outraged everyone. Right? I know Kathy and I live in outrage every day. So just raise your voice. Raise your voice. We don't want to see this happen again. Get out there and march if it's safe for you to do that. Volunteer. I know HIAS has a great volunteer page. Right now, a whole bunch of people are working on collecting comments on this new regulation that Kathy and I have been talking about, because it's right now in the notice and comment period through, I think, July 15th, I want to say, something like that, where the department has to take in comments and respond to all of the comments, which will at least slow down this regulation. So just trying to send in lots and lots of comments to explain why this is a bad idea. And there are law students working on this, there are law professors, but anyone can comment. And I'm sure there are folks who can share ideas about why this is a bad idea. And then, of course, get out and vote, right? I think there are a lot of ways. Just make sure that you're making your voice heard and making clear that the Trump administration is not doing this in our name. They're doing something against the law, with a blind eye to the tragedies of history, and we don't want to be counted amongst those who supported these actions. We want to be counted amongst those who stood up and spoke out and said, look at history. History has taught us that we can't keep doing this, and we have to return to who we are, which is a country that welcomes the stranger, that welcomes the immigrant, and provides humanitarian protection for those who need it the most, because we can, because we're wealthy, because we're compassionate, and because we want to.
Thank you. That's great. And I do want to just share that on HIAS Pennsylvania's website, www.hiaspa.org, there is a comment writing toolkit that is available for people who want to write and submit comments. And I just want to echo what Jaya said, that we want to definitely have as many people as possible submit comments in opposition to these rules. So thank you so much, Jaya, for all of your enlightening answers. Unfortunately, we've run out of time. For all of you who sent questions that we didn't get a chance to answer, they'll be answered in the comments below. And a recording of this special event will be available on our website at https://hiaspa.org/category/videos in a few days. Meanwhile, we are going to have an Ask Me Anything in late July called How Has Racism Shaped U.S. Immigration Policy? a particularly timely event. So I hope you'll join us for that. Look out for the postings for the date and time. And as always, you can learn more about how to support immigrants, DACA recipients, asylum seekers, other immigrants and refugees at www.hiaspa.org. Thank you so much. Take care.
Thank you.